So let's go. This is number one, I think.
Secretary Clinton, Senator Sanders favors what he calls Medicare for all. Now, you've said that what he is proposing would tear up Obamacare and replace it. Secretary Clinton, is it really fair to say that Bernie Sanders wants to kill Obamacare?
Well, Andrea, I am absolutely committed to universal health care. I've worked on this for a long time. People may remember that I took on the health insurance industry back in the 90s, and I didn't quit until we got the Children's Health Insurance Program that insures 8 million kids. And I certainly respect Senator Sanders' intentions. But when you're talking about health care, the details really matter. And therefore, we have been raising questions about the 9 bills that he introduced over 20 years as to how they would work and what would be the impact on people's health care. He didn't like that. His campaign didn't like it either. And tonight he's come out with a new health care plan. And again, we need to get into the details. But here's what I believe. The Democratic Party in the United States worked since Harry Truman to get the Affordable Care Act passed. We finally have a path to universal health care. We've accomplished so much already. I do not want to see the Republicans repeal it, and I don't want to see us start over again with a contentious debate. I want us to defend.
Did Bernie has a response to that? Okay, so we'll keep going. So that's sort of the Hillary frame.
Secretary Clinton didn't answer your question. Because what her campaign was saying, Bernie Sanders, who has fought for universal health care for my entire life, he wants to end Medicare, end Medicaid, end the Children's Health Insurance Program. That is nonsense. What a Medicare for all program does is finally provide in this country health care for every man, woman, and child as a right. We are paying the highest prices in the world for prescription drugs, getting ripped off. And here's the important point. We are spending far more per person on health care than the people of any other country. My proposal, provide health care to all people, get private insurance out of health insurance, lower the cost of health care for middle-class families by $5,000. That's the vision we need to take.
So, Bridget, what's going on there? It seems like that, Hillary is doing sort of two different things that and trying to square a circle in some respects. Because on one hand, this isn't practical, this isn't manageable. But then there's also some type of substantive problem with single payer, which I think is pretty, in pretty significant contrast to most Democratic primary voters.
Totally. I totally agree. I think, I think that I think Sanders is right. I think that her kind of calling him out, saying that he's against sort of this, overhaul of the healthcare system, I think is not accurate. I think that his campaign responded in like a really interesting way when I don't know if you saw that they produced like a photograph that Hillary Clinton had signed that said like, thank you for your tireless efforts to, ensure that everybody has health care. To now go back and say that he hasn't done that, I think he's right, but like that's not entirely fair. But I think you're right. I think that she's trying to sort of square a circle in terms of her position on health care. And I think, certainly Hillary Clinton is someone who I would personally say has been advocating for, health care for children for a very long time, but I don't feel very good about the way that she's attacking Bernie Sanders on healthcare in this way. I'm not a big fan of how she's sort of going about it.
Because do you think that what ends up happening with this is that in the context, this is a Democratic primary. So theoretically, we're trying to set a baseline here of what's politically possible and the best way to sort of make these arguments, writ large for a real social safety net. It seems like one of the, accusations and one of the realities of the Clintons is triangulation. And is she sort of providing the ammunition, even potentially against herself if she's president, and she pushes for some type of substantive expansion?
I mean, it certainly sounds that way. It's like it sounds like she wants voters to think like, oh, all these pie in the sky ideas, it's not going to work. But sort of not realizing that like this is a conversation I think the majority of voters in the United States want to have around healthcare. I think that healthcare is too expensive. I think that I think the strategy that she's taking ultimately will not do herself any favors down the line, but also it's like not what necessarily I think voters want to hear.